to meet the authors. We're here in Orlando at the Florida Writers Association, one of the biggest writers' conferences around, and we have over 500 authors here. And I'm privileged to have Dr. Wes here. Dr. Wes, thanks for coming in. Tell me your name here.
Thank you, Phil. My full name is Wes Rocki. Since nobody dares to pronounce Wiesław, I assume the Wes as a short nickname, which is funny to have Midwest cowboy name for this Polish man. Whatever.
That's wonderful. You got a great sense of humor. And you don't have a book out yet, but you're working on one. Tell us about this book that you've got in mind.
The book is my baby. I don't have children, so this is actually my baby.
All of our books are babies. I'm just saying that.
And I used to practice obstetrics back in Poland.
Okay.
So this is my very long pregnancy. It's coming to the delivery.
I like that.
The waters are not broken yet.
Not yet. Not quite out on press. You have great analogies. Very funny.
So the book has 3 parts. So either it will be book in 3 parts, or it will be actually 3 small books. The first has focus on relationship of chronic diseases to emotional trauma in childhood as a root cause of chronic diseases.
Wow.
You know, in medicine, you are one of the successful doctors because emergency medicine is very successful. But when we move to chronic diseases, medicine fails.
It's very difficult. So you can't cure diabetes, you can't cure hypertension. You can control them, but you fail in actually curing them.
Yeah, you control where the underlying condition progresses in the background. Yeah. And one of the reasons why we fail is that we don't identify the root causes of chronic diseases.
And you maintain that has to do with trauma in childhood.
Yes, this is the probably most important discovery in the last 10 years, that whatever we experience or don't experience, for example, attachment in childhood, gets encoded in our subconscious mind. Yeah. And subconscious mind is actually the mind which decides on our lifestyle, on our choices concerning health. Yeah. So not only there is a direct correlation of unresolved childhood trauma with something which would be obvious, like multiple marriages, divorces, financial failure, even incarceration, but the discovery of recent years show direct correlation of unresolved trauma to so-called somatic condition like diabetes, cancer, and whatever.
Maybe fibromyalgia, migraine headaches, a lot of things which a lot of times we can't really pinpoint causes for, but the people suffering, and it's like we displace your emotional issues into physical ailments.
Yes. So my unique twist on the survival of emotional trauma in childhood is that we develop unique skills, resilience, surviving unfortunate childhood. And then, rather than being a slave to the memories, we can use these unique skills to heal ourselves from chronic diseases.
Oh, wonderful.
So in other words, you got lemon, you made lemonade.
And you have to go through, you can use biofeedback or psychotherapy, or how do you heal this trauma?
So this is the topic of my possibly second book.
The second book? All right. I led up into that one, didn't I?
The unique trick is to say yes. Usually when we get sick, or even if we relate to painful memory, we resist. We say no. And resistance is very energy consuming and prevents us from having all resources. For example, I'm going to a doctor and doctor tells me a diagnosis and say it is bad diagnosis. Yeah. And in very second, my whole universe of resources collapses to that one diagnosis.
Yeah. Someone comes and says, I've had that in the ER all the time. Someone comes in, they have a cough, like an x-ray, and I have to tell them, your x-ray shows you have lung cancer, and their whole life is shattered.
Yes, and it's shattered because it starts with no.
Yeah.
No! Why me? No. And the possible reversal is to say yes. Not yes to the cancer, but yes to my resources of dealing with the cancer. And that the idea is to say yes and. So in other words, I'm getting this bad diagnosis, and I say, yes, doctor, I hear you, I recognize your knowledge, and I believe that I will explore this. My world opens up to all possibilities rather than collapsing to one. And there is one modality which I am so excited about, because it's art, and medicine is supposed to be art.
There's a lot of art to it.
Like in medical schools, we have medical art building, right?
Yeah.
So where is the art? So now we're coming to the art.
This is book 3?
This is book 3. And book 3 is yes and. I am trained in improv. Improv is a theatrical form, which now is more common known as a comedy improv.
Yeah.
When we interact, and what you are saying to me is so-called offering, to which I say yes, and I build on that my story.
Okay.
And the rule is that I continue what you invited me to, expanding to my area, but with respecting you, with making you looking good. And this, this where medicine meets with the spirituality, with New Age, because, probably you heard the book by Eckhart Tolle, The Power of Now.
Yeah.
That everything what happens is in now, and the power, including healing, is in the now. So what is the most practical way to arrive to now than to say yes to what is?
I see.
So I have already trained in several places in improv, including medical improv. You probably didn't hear that in medical school, Northwestern Medical School in Chicago, there's 5-day program in medical improv, which I participated.
I wasn't aware of it at all.
Yeah, you see?
Yeah.
That's why my book will be so popular.
Yes. All those things people haven't heard of. I like that.
And also, everything relates to self-healing. I believe that every healing is self-healing. So if we can bring the rules of improv to inner dialogue, because we obviously talk to each other all the time, right?
You're talking to me now.
We are talking to each other, and I am talking to each other, yet I am speaking to different personas in my head.
Yeah.
One persona is laughing to you, other persona is bringing science. There are personas.
Yeah.
And my quality of life, my quality of health, and potential for healing is my capacity to utilize all these personas in my head. Which, if I say yes and, then the very crowded, unruly crowd in my head becomes very orderly, like management board in good company, like having laser light, which brings solution and allow me to make right health choices. And healing, any healing intervention is effective in chronic diseases only when it has capacity of becoming lifestyle.
So can you give us an example? Let's be specific. If somebody has has some diagnosis, say they have hypertension, that's a pretty straightforward one. How can your methods help them deal with hypertension?
Okay, so say you are my doctor, and you say,
take these pills because your blood pressure is too high, and you need to cut down on your salt diet, and you need to exercise and lose a little bit of weight. These are things I'd probably say to you on a first diagnosis of hypertension.
yes, doctor. And why should I do it?
Why should you do it? Because the high blood pressure is damaging your vessels, and you're more likely to have a heart attack, a stroke, eye issues, kidney problems. If you don't control your blood pressure, it will do you a lot of harm over time.
Yes, and I wonder what is good about my high blood pressure.
What's good about it? Well, I suppose it is innervating parts of your body that have atherosclerosis a little better.
Wow, yes. And what if I can use a food instead of some pills? What do it do to my blood pressure?
If you can use food instead of your pills, if you can get your blood pressure down by proper diet, which a lot of people can, lose a little bit of weight, cut down the sugar, alcohol and cigarettes, a lot of people's blood pressure, start exercising, a lot of people's blood pressure comes right down.
Yes, and this will prolong my life, right?
Statistically, yes.
But if I have no sugar, no alcohol, no women...
I didn't say no women.
Yes, I agree to that. And yes, I wonder why I got my blood pressure.
That would be a long discussion. There's a lot of possibilities. It could be genetic. It could be also the things you have been doing in the past. Not exercising enough, putting on weight, smoking, bad diet. Those things add up. A lot of it's genetics. You're born to have high blood pressure.
Yes, wow. So there are many different factors.
There are many different factors.
How can I help you to give you the best advice? Because you gave me so many homework to do.
I did. Give you a lot of choices on how to improve your blood pressure. You can start by exercising every day. That will make a big difference. Do you do that now?
Yes, and I would like to do this more. What do you think will motivate me besides being scared by my blood pressure?
You'll feel better. You'll sleep better. You'll be able to do more with your life. You'll breathe better. Exercising daily really makes a big difference in your life. Gets those endorphins going.
Wow, and yes, and if you feel better, your health is better, and you know what is better for you.
That's a good thing. Well, we have had a wonderful interview today, gone a bit over time, and that's fine. And it's been wonderful seeing you, Dr. Wes. You're so funny and smart and really giving us good insight into how to improve our lives. When will your book come out?
I feel more and more the labor pain. So I think that I will be dilated like 2 centimeters in 2 months.
Okay.
So if I progress according to my obstetrics knowledge, it's a Polish good knowledge,
Yes.
I'll be done by Christmas.
Christmas of next year or this year?
No, this year.
Oh, well, do you have a title for your book?
This is secret. I'm still brewing on that.
It's good to keep these things secret. Well, do you have a website?
Yes. My website is www.selfhealingcare.com, and my Facebook page is called You Are Your Own Doctor.
I like that. Dr.
Thanks
Wes.
much, Phil, and I appreciate very much you listening to this video. Thank you.
Thanks for tuning in to Meet the Doctors. We'll be back with future episodes, perhaps in just a few minutes after these messages, or if not, in the next week or two. We have a whole bunch of different authors and fun for you all at home. Bye-bye.